Hello, this is Richard Kung, President and Founder of ergoBeBuzz. In today's Ergo tip, we're going to talk about the topic, Cradle to the Grave. Most people think of cradling the phone as a normal thing. But you can read the news and you can find all sorts of articles on how multitasking with a cell phone has caused major distraction and has led to many deaths and injuries. I'm going to add now another item to the list. Muscle pain. Before we go into talking about that in more specifics, let's consider some topics. First, static posture. Static posture is any time or posture that you hold for a period of time. The longer you hold, the more strain applies to the muscle or the area in which you are holding. Also, did you know, a little Jeopardy FYI tip you can use with your friends, if you hold your arm about 90 degrees, did you realize you're actually cutting off about 80% of the blood circulation to your extremity? So if you try to work overhead, even less so. Have you ever tried to stack some cans in a pantry, change a fan overhead, and what happens? 1 minute, 2 minutes, 5 minutes later, your arm starts to feel very tired. It's all because of lack of blood circulation. The lack of blood causes your muscles to fatigue because they don't have the food to be able to produce and continue working. Now let's look at cradling the phone. What happens when you cradle a phone? Most people tend to have a dominant side, whether it's the left or the right. They tend to use it quite a bit. When you cradle a phone, you have static posture in the neck and in the shoulder. And so if you're trying to have a lot of phone calls or some phone calls, you want to think about the frequency and duration of your phone cradling. For example, let's say you need to make one phone call in a day, and that phone call is only 1 minute long. That is not very long, and every time you do it, you don't do it for a very long time. That will reduce your risk to cradling the phone. Let's look at it again. But let's say you have to make 5, 10 phone calls in a day, and each one is 5 to 10 minutes. Now all of a sudden you've increased the frequency at how much you do it and how long you do it every single time. This will dramatically increase your risk to cradling the phone. Now, what can you do if you cradle the phone? Well, first, try to use a wireless headset if possible. This will free the need to have to cradle. If you don't have access to a wireless model, you can try to get a cheap wired model. These are very effective, especially in cubicles. Now, if you don't have that option, you can go with the even cheaper option. Use your speakerphone on your phone. That way you can use hands-free, you can do other things, and you don't have to add continuous strain and stress on your neck and shoulders during a conversation. Now, let's say that doesn't work either. You're in a cubicle setting, so you don't have the privacy to be able to use a speakerphone, nor do you have the budget to be able to do so. What can you do? If you are forced to absolutely cradle the phone, your best suggestion and solution is to use the other side. So if you cradle on the left side all the time, try cradling on the right. This will distribute the load so that one shoulder and neck side does not have more strain than the other. This is similar to stretching your neck one way or the other. Make sure you take stretches. It's just like a runner who doesn't warm up. You're more prone to strain the muscles if you don't stretch them beforehand. Now, what about those handsets, shoulder rests that people may use to minimize the distance between the phone and the neck? Those are not bad. However, keep in mind that the goal is to minimize cradling of the phone. So the shoulder rest may, in some sense, encourage cradling of the phone. So in situations possible, it's better to avoid using those shoulder rests if possible. Do this and your neck will thank you in the long run. So remember, avoid cradling the phone if possible, and if you absolutely must, distribute the load on both sides so that you don't have to cradle to the grave. This is Richard Kung, and you're watching ergoBeBuzz. Thank you for watching, and we'll see you next time.